And here we go. Welcome everybody to The Big Idea. I am your host, Dr. Jeffrey Hanna at Clear Chiropractic right here in Spokane, Washington. And today what we're going to be talking about is we're going to be talking about tinnitus. This one here was a request that came out on YouTube, and they wanted to know, in the same way they do with all these big idea videos, how is it possible that a little problem where your head meets your neck can actually have very big implications affecting your health, your well-being, your overall quality of life? So what is tinnitus? Most people that I've actually met at some point have actually experienced this one. Kind of like most people, at least at some point in their life, have experienced a headache. Either because something's wrong with their neck, or they accidentally drank a little too much alcohol, or they're not drinking enough coffee, different kinds of things like that, chemical sensitivities. So tinnitus, what is it? It is where a person is experiencing a ringing, a buzzing noise inside of their ear, but there is no outside source for that hearing. And this can range from just a mild little boop, annoyance, oh, there's that little sound, and then it's gone, to where it's quite debilitating. It's literally like overwhelming your entire brain, all your circuitry, can't focus, can't hear, can't sleep, and that, of course, is going to drive a person absolutely insane. And so most people I know, they have actually experienced a little of this odd ringing at times, or they've been to a loud rock concert, something like that, and then they're left with a little bit of a persistent buzzing ear in their noise for a couple of days. It's something kind of like that. And it's oftentimes associated with a lot of other symptoms and syndromes, including headaches, migraine, vertigo, especially something that's known as a Meniere's disease, dizziness, chronic fatigue, fibromyalgia. It's associated with a lot of different things. But the question is, why is that? It's very much like there's a ghost in the machine. I mean, if a person has to say, okay, if I have to choose between vertigo or tinnitus, they're going to say, I'll pick the tinnitus, because vertigo you just can't block out at all. And I'm not saying tinnitus is easy by any stretch of the imagination. Or the same thing, if you have to choose between migraine and tinnitus, people are going to say, you know what, I don't want the migraine, I'll take the tinnitus, please, if you have that kind of a Sophie's choice. Now, ideally, we're not going to have any of that. But nevertheless, it oftentimes takes the back burner to these other symptoms, these other syndromes that can be involved and plaguing a person at a given time. And it's very frustrating as well, you know, even for the clinicians such as myself, is we've got people who, you know, yep, they describe tinnitus, and some people completely goes away with care. Other people, okay, yeah, this should help, but for some reason it doesn't change. So to a certain degree, it does seem like, you know, there's a ghost in the machine. There is something that is going on the inside where your body is playing a trick on your brain, and your brain is misperceiving information that it is receiving from some other kind of source, and it's interpreting it as if it's an auditory signal, when in fact it's not the case. So the question is what is causing it? Now, for a lot of people, if they're experiencing transient deafness that goes with it, vertigo, or if the ringing is pronounced enough, odds are what you've also done is you have gone to see a person who's going to be looking at your ears to find out, okay, do you have what's called sensory neural damage? That is damage to the nerves, to the tympanic membrane, to your ear itself. And as a consequence of that, is it in the absence of signals that your brain is filling in the noise with this kind of noise right here? So what happens? A person goes to somebody who's going to be doing some audiometric testing, and they're going to find out, yes, you have sensory neural damage to one ear or the other. And this can be either as a consequence of a single loud noise that like burst an eardrum, something like that. So a loud bang, a gunshot, different things like that. It can also be industrially related. That is, you worked in a factory, you worked in an airport, you worked in a place or a space where there was a lot of noise and it's damaged your hearing over a period of time. So if that's the case, we're dealing with what is known as the sensory neural tinnitus. And this one, in all honesty, is very, very tricky to resolve, because what it means is it means literally needing to rewire, remap the brain. Can be done, but it's a little bit more challenging. Now, for a great many other people, they have these audiometric tests, They have brain MRIs, but we're not finding any sign of pathology. They're told, no, your hearing is just fine. There's not an issue with that. And yet, people are still experiencing this ringing kind of noise. In this particular circumstance, this takes us very likely to what is known as a somatosensory tinnitus. And what this is, I want you to think of it like this. This is like an internal alarm system going off in your brain because there is some kind of problem going on elsewhere in your body. And I'll show you a little picture here which might help explain what I mean by that. All right, so here we go, straight out of Grey's Anatomy. What we are looking at is a schematic of your brainstem. And I don't expect you to know all of the bits and pieces here, but in brief, we'll say, okay, this is one of the primary processing hubs at the upper part of your brainstem, really the midbrain, we call it the thalamus. Over here then are going to be what's called the pons. It's the crisscross. It's the major communication channel. Lots and lots of stuff going on there. Down through here are going to be, it's going to be the base of your brainstem, what's known as the medulla. That is where all of your vital life centers are. Heart rate, respiration rate, digestive system, all of that essential stuff. It's also the primary filter for all of the information going up and coming back down from your brain. And then down at the very bottom here, this is going to represent your spinal cord itself. And the spinal cord at this level, it's receiving wires, it's receiving electrical sensory information from all parts of your body, from your muscles, your ligaments, your nerves, the connective tissue, your blood vessels, that's super duper important, and also from great many of the internal organs. And all of this information gets dumped in and it's pooled into the brainstem, and it goes up by a series of different pathways, including these ones right here that I will be mentioning in just a sec. Don't worry about that. But what I want to say first, I want to say that as it relates to your body and your brain's ability to be processing information, it's going to be wanting to receive a huge amount of information of all places from your head, your jaw, and also your neck. Why? The alignment and the spatial orientation of those structures is essential for your brain to be able to work correctly. And it's going to do whatever it takes in order to maintain the integrity around your brainstem and keep your head as level relative to the rest of your body, even if that means sacrificing some of the other stuff. So the take home here, your neck is always sending your brain information about where it is in open space. And it's going to be sending 3 primary sensory signals. The first one is going to be information as it relates to pain, that is physical damage. The second one is information on what's called proprioception, or think of it as posturoreception. That is information that has to do with the tension, the tone of your muscles. And the third type is going to be what's known as pressure reception. And this is about spatial orientation, about movement. And it's essential that your brain receives this kind of information so that it knows where it is in open space again. And so what I'm going to be illustrating on the little graphic right here, if you see all of these little blue wires that crisscross all over the place like this, that's the whole point. Information from your neck will actually crisscross with the various clusters of cells that are responsible for processing the vestibular, that is the balance, the visual, sight, and also the hearing information. In particular, in your brainstem is a little something which is known as the superior olivary nucleus, right here. What this little cluster of cells is involved is with the modulation of hearing information. In other words, is it too loud? Is it too quiet? What is the noise that's actually going on? So I want you to imagine a couple of possibilities here as it relates to your neck in particular. And this is also an important kind of thing, because when a person has had some kind of an injury to the neck, not necessarily broken bone, dislocation, or anything like that, but especially if, I've got a bit of a headache, I've got a bit of shoulder pain, neck pain, different things like that, your brain wants to keep a very close eye on injuries that have been damaged. And so what it's going to say is, hey, we want more continuous feedback about what's going on in that circumstance and in that situation. But what that can do is that can effectively overload your circuitry. I want you to imagine that whatever device you're watching this video on right now, I want you to not just watch this video, but I want you to turn on all of the programs on your computer, and I want you to start downloading a few movies, and I want you to upload a few files. I want you to max the computer out, increase the volume of all the activity. What's going to happen? It's going to crash, is the short of it. Now, your brain typically will not crash, but what will happen instead is all of this processing and all of this sensory information is going to start to congest or spill over into other areas of the brain where it's not necessarily able to be filtered properly, and it can show up in weird kinds of sensations. And so what I'm saying is that in this way, you can actually have a physical issue with your neck, but what's happening is it's manifesting as an abnormal noise that only you can hear. Now, here's the interesting thing. A lot of times what people say is, I don't think that there's really a problem because I'm not experiencing pain. Well, what did we say? We said that there are 3 kinds of sensory nerve receptors in your neck. Pain is only one of them. And that one is the major alarm that's going off. So what I want you to consider is the possibility that tinnitus, what it actually represents, is a quote-unquote silent alarm. Not exactly silent, because again, if it's going on in your head, it's driving you insane. However, if you're not experiencing pain, but you're still experiencing this auditory sensation, think of it as the silent or the internal alarm, where there's information coming from some part of your body. And again, neck is a major contributor because of how we are wired like this, that can cause us to experience tinnitus in that particular regard. And what that means is it means that, okay, there's something that's going on that we should probably want to address. Again, whether or not it's causing us pain, it still is causing us other kinds of problems. And then, of course, if you compound that, because issues with the neck can affect your jaw, issues with your jaw can affect your neck, inside of your jaw, there is a little bit of cartilage that is responsible, that contains these exact same kinds of neuroreceptors. And of course, because your jaw, you'll see it's located right here, super duper close to your ear, a lot of times that will also manifest as a tinnitus kind of issue. Oftentimes I ask people to do this. I say, point to your ear. Okay, yeah, you can point to your ear. And they will say, okay, can you point to your jaw? And they'll typically come down here. No, your jaw is here. And then I say, point to the top bone in your neck. And then they're kind of like, I don't know where it is. And it is here. So you see, ear, jaw, top vertebra in your neck. That's how close they are. They all have the exact same neurology associated with them. Slightly different wires, yes, but all of those exact same pain, pressure, and proprioreceptors. Therefore, a problem with any one of them can be producing this kind of a tinnitus. And that is very important, again, for people to understand if and when they've already had the brain MRIs, all that sort of stuff, but nobody can figure out what is actually causing the issue. Think of it instead as an internal alarm where something is not right in your body. It's then a question of finding out what is it and what can you do about it. Now, there is actually an additional subtype of this somatosensory tinnitus that's probably worth mentioning, and this is what's known as a pulsatile tinnitus. This is where a person says something to the effect of, I can hear my heartbeat in my ears. It's like every time that my pulse is going, it's this rushing sound that we can hear on the inside. And the question is why is this? Sometimes people are worried, oh, my goodness, is my blood pressure up? Am I about to have a stroke? Something like that. Unfortunately, that is usually not the case. But nevertheless, it can be, quite disconcerting. And again, it can be a mild annoyance to quite debilitating. Question is how is this happening and what is going on? Well, a couple things, again, worth considering. Do you remember how we talked about the pain, the proprio, and then the pressure receptors? Not just muscles, ligaments, nerves, but also blood vessels? That's kind of the key. Is that if there are subtle aberrations, and we're not talking about major constrictions of your blood vessels, but where there might be just this subtle little thing, something's not quite right, it's not quite flowing right, your brain is not stupid. It's receiving that information. It's just not necessarily always showing up as pain or pathology. And so in that particular regard, if and when we can hear our heartbeat in our ear, this pulsatile tinnitus, oftentimes what we're feeling, what we're experiencing is where something is well and truly affecting blood flow to, from, or within our brain. And again, the question is, why is that? And especially as it relates to a pulsatile tinnitus, there's an interesting phenomenon which is known as stylohyaloid calcification. It's sometimes known as Eagle syndrome or Ernest syndrome, and it's also sometimes known as what's called the styloid jugular nutcracker, of all weird descriptions. And I think the easiest way that I can demonstrate this is actually by going over to the video and showing you a depiction of what this actually looks like. All right, so what do we have here? This is what we call a cone beam CT. This is a 3D reconstruction of a person's head. And so we can see there the side of their skull, eyes, jawline, teeth, and then the vertebrae in their neck. So the C1, the C2, the C3. And I'll reiterate something that I had said before. Again, you can't see it because soft tissue goes away here, but a person's ear is located right here. In fact, there's the ear hole right there. Right here is where their jaw is located. And then right here is where their C1 is located. And all of that is no more than half an inch in total diameter. So very important structures, really, really close to each other. Now, we've already mentioned how each of the joints in the neck like this, so the joints that are designed for movement, but also the shock absorbers, the discs, and also the ligaments that are located within that, these are laden with those pressure, pain, and proprioceptors that are essential for normal function and normal information going to the brain. But there are also, what you can't see here, are a series of blood vessels that actually run along the front of the vertebra like this. And for some people, you will also have this interesting little structure right here. So I'm going to scroll a little forward in this video. We're going to turn it sideways just a bit like that. Aha. And so what you might see is this dagger looking formation like this. This is what's known as styloid elongation. It's a little bit more pronounced in this person's case. But in brief, what we normally have is any bony structure in your body. The reason that it's bony or elongated is because there is a muscle or a ligament or something like that that's attached to it. And what it does is it lengthens itself because of the tension that's on it. However, if you've ever got too much tension on any given thing in your body, then it starts to really elongate, and what your body does is it actually lays down more calcium or lays down more bone in order to provide more strength. The caveat with that is it loses some of its flexibility, and as a consequence, if there is ever an issue, it's kind of like having a pebble in your shoe. It can become a potential source of irritation. And so what we're showcasing right here, normally, this little spicule of bone will be maybe about that long. Now, that's about it. But as you can see, it keeps going all the way down like this. And not just that, but you may notice as I fast forward here a little bit, there we go again. Wait, there it is. That it comes forward, it comes down like this. So it normally should be ending right about here, but it keeps going until about here, and then you might see like there's a little crease in it right through there. And that's because that's where the bone ends and where it starts to then become the tendon insertion, what's known as the stylohyoid ligament. And so what's happening here is there's just way too much tension on this structure. And this is oftentimes associated with jaw pain, swallowing difficulties. If it's really pronounced, it can cause a person to black out, vertigo, and it can also produce chronic pain, fibromyalgia, different kinds of things like that, headaches, migraines, and so forth. And so here's a person who actually had elongation on both sides, and as you can see over here, it's even more pronounced. So again, normal length is going to be something like this, but this person's elongates all the way down here, but wait, there's more. Then you've also got this calcific tendon going all the way down like that to where it's attaching in through the bone on this part right through here. Now, why does this condition matter? Well, what I'll do is I'll fast forward just a little bit now so that we're looking at a top-down approach right through here. So a bit of spatial orientation. You can see that there are these little black canals right here. So that's the ear canal right there. And I'll point out and I'll show you, if you see these little bumps right here, that is the jaw. In fact, what I always recommend, if you want to know where your jaw really is in open space, put your fingers in your ears and open your mouth up and down like that. That little movement you feel, that is your jaw moving right there, or at least should be moving. Here then will represent where the base of your skull is, and then you might notice these little white things right here. Those are those styloid processes. And again, I want you to think of it as a potential pebble in your shoe. And what I'm going to do now is I'm going to scroll forward just a wee little bit. So you'll notice we're no longer at the level of the ear. We've come down just a bit here. But we can still see those structures right there. And then this is like the bottom part of the jaw here. And let's come a little bit farther forward now to right there. So where we are is we are at the level of the C1 and the tip of the C2 vertebra. And you'll see that, okay, here's where your spinal cord normally should be living. And then this is the outline of the vertebra here, kind of like my hand, like this, with the two bits on the side, which are muscle attachments. And you'll see that there is this space between here and between the bone itself right here. And then the same thing on the other side. Now, in this particular person's case, these findings that I'm showing with those elongated styloids, this person's not experiencing a pulsatile tinnitus. But how does this relate? It's because it's a potential risk factor. So when a person has a neck injury, okay, again, not broken, not dislocated, not unstable, but nothing to scoff at either. The most common configuration is what it does is it actually slips and it misaligns forward. Why? Because that's where we are weakest as human beings. It's probably about 80% of all the misalignments that we see in practice are forward-natured misalignments. So consider this is the front, so here's the person's teeth, and then here's the back of their head. That if this vertebra was to actually go forward just a wee little bit, what's going to happen to the relative size of the space between the little spiky bit and between the tip of the bone? It's going to be decreased. Exactly. And this space right here, this is where you have the artery that supplies 2/3 of the blood to your brain, the jugular vein, well, the internal jugular vein, which is draining the primary drainage pathway for the blood coming back down from your brain. It's also where you have the glossopharyngeal nerve, which is involved with swallowing. It's also involved to a certain degree with speech. It's also involved with salivation. It's also where you've got the location of the vagus nerve, which is sending all of the information from your brain to your heart, to your lungs, to your digestive, to your reproductive system, so that your body can work internally. It's also receiving all of the information coming back. And last but not least, it's also the location of what's called the spinal accessory nerve, which is going to be a cluster of nerves that are involved with moving your head like this, and also tension through your trap muscles. Now, as it particularly relates to the blood flow, and this comes back again, believe it or not, to that pulsatile tinnitus, is maybe not as a consequence of that styloid process being elongated, but if that vertebra has misaligned forward, what's going to happen to the relative area around the blood flow? Exactly. It's going to be ever so slightly narrow and constricted. And if you have fluid not going to or from your brain the right way, how can that manifest? As we said, one possibility, tinnitus. Other possibilities, a person can experience what's known as presyncope. That is the feeling of needing to faint or pass out. It can make a person feel dizzy. It can make a person feel nauseated. It can make a person feel vertigo. It can make a person feel migraine. It can also start screwing around with other functions of the brain that, again, you might never think are actually coming from a problem with the neck. You have the brain MRI. The brain MRI says, nope, there's no pathology there whatsoever. But it doesn't consider the functional relationships or the functional disrelationships about how things are going on in your body, yes or no. It's looking for the broken bones, the dislocations, the tumors, the infections, all of that sort of stuff. But again, what have we said about tinnitus in particular? Think of it as an internal alarm system. Just because there is no pathology, just because it's not producing pain, does not necessarily mean that everything is necessarily okay. It's good to always have the audiometric test, always have the MRI, rule out the dangerous, scary stuff. But if you've done that and you're still experiencing this, or if you're experiencing other symptoms that we've mentioned here, and it's like, okay, I experienced tinnitus and I also have these. I wonder if there could be a connection. At least in my own experience, there usually is. It's a question then of where is it coming from? And again, one of the most critical areas that demands investigation then is looking at the health of your upper neck. So I hope that that makes sense. And again, explains a little bit about how this mysterious and this weird sensation, this buzzing noise in the ears can actually be coming from and can be an internal clue that there's actually something else that's going on in our body. We probably shouldn't just ignore it, because otherwise it can grow and evolve, unfortunately, into something oh so terribly much worse. So, hope you guys have enjoyed this little video, found it valuable, entertaining, maybe a little bit at the same point as well. If you have enjoyed it, please, as always, like, subscribe to the channel, and share the video with friends, family who you think may need or benefit from this information. It helps the YouTube algorithm so that other people can find this information as well. And if you're looking then for help, something we've said here, yeah, I need to check this out, we recommend go to blairchiropractic.com. That's where you'll find a directory. You'll be able to find Blair Upper Cervical Chiropractor, does the exact same kind of work that I do in your local area, who may be able to help you out. And if, of course, you are in the local Spokane, the Eastern Washington, the Northern Idaho region, we would be delighted to help you. You can reach out to me personally at my website, which is drjeffreyhanna.com, which is where we've got links to more blogs like this, where we've got a number of other videos, and where you can also send me an email where you can get in touch with me personally. I'd be happy to have a chat with you, get a little bit more personal details, and you can share your story, find out what I can do to help you out. And if, of course, you're ready to take that next leap right off the bat, nope, I want to be able to, get some help with this, have somebody have a look at this, go to our company's website, which is clearchirospokane.com, and you can call us to make an appointment at 509-315-8166. Mention that you saw this video, and we'll be able to coordinate a few special little things there for you as well. Again, 509-315-8166. As always, thanks for watching. Appreciate doing these videos, sharing it with you guys, and getting your feedback. This is Dr. Jeffrey Hanna from Clear Chiropractic here in Spokane, Washington. Get well, live well, stay well. Take care until next time. Bye-bye.